Matos Leal, and I'm a nurse here at Alta Bates Hospital, and we're on strike today for the 7th time. We're still without a contract because this organization insists on putting profits before their patients and their nurses. They're trying to get rid of our sick leave. They're trying to bring our wages back to the 1970s, trying to eliminate decades of bargaining. Yesterday we were in negotiations. Instead of discussing our contract, which they call the main table, they decided to discuss layoffs instead. And they made an announcement. They're eliminating 8 FTEs from the infusion center, which serves mostly people with cancer that come to get their chemotherapy, from Summit Medical Center in Oakland. So they're not just attacking nurses and trying to bring back wages and benefits for nurses, back 30 years. They're also eliminating patient care services for the community.
How can they be in charge of healthcare? How can they be in charge of healthcare when they're doing this kind of stuff?
Yes, they're just here to make money. This organization made $300 million on the first quarter of this year. Okay, so that's the kind of money that Sutter Health makes. And they are doing it by, attacking nurses like they are today, and threatening their benefits and their pay, and eliminating services to the community.
It seems like the nurses are getting a lot more angrier about management at this point.
Oh yes, I was really surprised this morning when I got off my vehicle. There was nurses up and down here, and it was pouring. Everybody with an umbrella. So we're pretty determined. We're not going to give up this fight because we're fighting for ourselves, which we are part of the community. But we're also fighting for our patients and, on the health care that they need, which this organization doesn't seem interested in doing. They're just coming here to take advantage of our communities and line their pockets with money. Been a nurse for 35 years, but, with this organization for 23.
My name is Bridget. I work in OB, high-risk OB. We're trying to protect the interest of our patients in the community. That's what we're trying to do.
Labor Video Party, KPFA.
KPFA, yeah. And we've been at this is the 7th strike we've been on, and we are not going to relent, because this is very important. The corporations are trying to take the middle class way back to the 50s. And it sucks. Basically, it sucks because this kind of stuff, it erodes the gains we've made throughout the years, and Obama has got a big problem on his hand now because all the votes that have been given to him now, he needs to cough up, face these big corporations, because everybody's blaming Obamacare for the problems going on. But this is a projection. It hasn't arrived yet. So we need to have a nice contract, keep support in the community, all the services that are being canceled, bring them back, because when our patients are sick, we are sick too.
This company is pretty arrogant. They're arrogant. They seem to be pretty arrogant.
Oh no, they treat us like we're doormats. We're we're at a meeting one time, federal mediators meeting. They said, "You are the heart of the hospital. Is this how you treat your heart? You take it out and stomp on it? You don't have a life."
Hi, my name is Beth Sherry. I'm a labor and delivery nurse here at Alta Bates. I've been here for over 6 years, and I started at a different Sutter facility and transferred here.
And why do you think management is taking such a hard line toward the union?
Because they want to keep their paychecks. It's all about the money. I'm personally one of the 435 jobs they'd like to cut. I have a weekend-only position. I have a 5-year-old and a 3-year-old, and they want to eliminate my position. There hasn't been any offer for another position, so they want to send me to the unemployment line while they keep stuffing their pockets. Pat Fry makes $2,300 an hour when you work out his salary, and obviously me as a 35-year-old nurse I'm not important to this hospital.
And but that would affect the patients. Who's going to do the work if they lay these workers off?
I have no idea. I'm guessing maybe they want younger nurses that they can mold and scare, or they want to just give more patient assignments and try to do away with our state ratios. They've been doing that for weeks. We've made complaints to the state.
Isn't that illegal?
It is illegal, and complaints have been made to the state. The state has come in to investigate. I don't know what has happened from that aftermath. They basically brought in for us more travelers instead of hiring permanent staff to help us on our units. We had 680 babies born in the month of August. I did not have a lunch break or a 15-minute break for 5 weeks straight.
Why shouldn't there be real action, criminal action? Because it seems like they're putting the patients in danger if the workers are so harried or harassed that they can't even keep up with taking care of the patients.
My personal fear is that they have some regulating agencies in their pockets. That's my personal fear, because I don't know why these things are being tolerated, why it's happening, why it continues to happen.
Well, the regulating agencies, Governor Brown, the government agencies, I mean, you think that they should enforce these rules to protect the workers and the patients?
They should. They definitely should. I mean, OSHA should be here. The California State Department of Health should be here, and they should be here regulating this daily, because things are occurring inside that shouldn't be.
What are those things?
Just not having enough staff, which is unsafe for the patients. Not getting our meals, not getting our break, not following basic labor laws in the state of California.
Such as?
Meals.
Oh, meals.
Meals, rest breaks, overtime.
So how many hours do you work, say, when they violate these rules, would you be working?
Yesterday I stayed, I'm an 8-hour shift nurse, I worked 12 and a half hours, I did not get a lunch break, and I did not get a meal break.
So you worked 12 and a half hours yesterday without a lunch break and a meal break?
Yes, but OSHA says it's okay as long as they compensate me for not having my lunch or my meal, and so I clock in that I don't get it, and I get compensated for it. So I guess by law, as long as you're compensated for it, their hands are tied.
But in the healthcare industry, wouldn't you want workers that are properly...
Yes, because you don't want somebody with low blood sugar passing out at your bedside. You don't want me to become a patient while I'm at work. Then they're down a nurse, and then they have to find a nurse to take care of those patients, and then they have to take care of me. Then they've just added...
What does that say about healthcare in America, when the workers who work in healthcare themselves are so stressed out and have bad conditions that they themselves become ill?
It's terrible, because we need to work, because we have families to support, and something needs to be done on a greater level about healthcare for all. And these corporations have to stop caring so much about their money and start caring about their patients and their workers, because we are their backbone.
It seems like there are a lot more nurses out here since the last strike. I mean, it seems like people...
Definitely, it's the tension is increasing within the hospital. They did start implementing at Sutter Delta. So what that means is the nurses who didn't work the 30 hours a week lost their health care. So you have nurses who are 60 years old, not close to retirement, who work 24 hours a week, and now they are without health care. They got a letter in the mail, and the health care was gone. And they're threatening to do that to 435 of us here, as well as cut our pay, cut our sick time, cut our vacation time, cut more services. We've already closed the cath lab here. There's only a cath lab in Oakland. So if you have a heart attack at UC Berkeley, you've got to go all the way to Summit now. You can't come here, because there's no way, they can't help you here if you need a cardiac catheterization.
So they're putting the public in danger by these cuts, huh?
Yes, they are. Yes, they are. Because they're trying to put different services at different facilities. So it's just not open generally to the public. So people in Berkeley have to go to Oakland or have to go to doctors. So it's terrible. It's an embarrassment, and I'm embarrassed to work for a greedy corporation. But I love my fellow employees, And, I live in this community, and I love working in my community.
And you're going to stay fighting until you solve
Stay
this?
fighting until they throw me out or discipline me for something. They'll find something. They'll find this on YouTube. And then they'll call, because they are doing that too. They're
retaliating?
They are retaliating. They're trying to find any reason to get rid of anybody who they can get rid of. And they're not replacing. They're not replacing. So they're just making us work harder and work more short-staffed.
So what can people do to support the nurses here and to protect their health care?
In the way of the community, I would say talk to the media as much as possible. Write letters to Chuck Prosper, our CEO, Pat Fry, the CEO of Sutter, Barbara Lee, Governor Brown, Obama. We need help. We need help, and we need the public support because we take care of the public.
So it's a health and safety issue for the public, that's what you're saying?
Yeah. And for the employees as well, if we lose everything that they're threatening to take away.
Okay, thank you.
You're welcome.
I'm just giving you this. This is what they're handing out to the community.
Okay.
It's kind of like some of the cuts they've made, the lies.
Is looking at us, nurses in the
Nurses are starting to organize?
Nurses are starting to organize in Texas, in Florida, in New York, in states where they don't have set patient ratios. They're forming, and they're looking at us because we have the most powerful contract. And if we give up, we will screw up. We will mess it all up for them. We will, so we can't give up this fight. Kaiser's looking at us in this state. Seton's contract's almost up. But the whole rest of the country rests on our shoulders. So if we give up, we're going to let a lot of nurses down, and people are not going to want to go into the profession.
It sounds like there's a national healthcare emergency in this country.
Yes, there is. You're right. There is. I mean, this has to be settled. This has to be settled. And so we can move on. So we can take care of patients. So we can go back to work and not be scared and not be afraid for our jobs. I mean, because, I didn't go to school to be out here. I went to school to be in there.
You want to do your job, which is taking care of people.
Yes. That's what I went to school for. I went to school to care for people, take care of them, take care of their families, to educate them, to be their advocate. And right now I'm not able to do that because they won't bargain with us. There's no bargaining happening.
Sutter, you can't hide. We can see your greedy side.
My name is Robert Lieber, Lieber. I'm a nurse here at Alta Bates and a member of the Albany City Council.
And why are you having the action here today?
Well, Sutter is a corporation that's trying to break the union, and Alta Bates is the center of their project. They've offered numerous takeaways to us as saying that they're benefits and rolling nursing back really 30 years to where they were when my mother was a nurse. No sick time.
They don't want you to have any sick time?
No, they want to pool all of our off days into, a big pool, like paid time off, and thus reducing many days, at least 12 off the totals, and then having control over all of our educational leave, which they give us because we have to maintain our licenses. Not only that, taking away control at the bedside more and more, and implementing a top-down management system where nurses have less control over their practices at the bedside, and it's just something we won't stand for. It's a danger to the public, not to mention a rollback of nurses' hard-fought rights over the last 30 years.
And how would this affect patients if they were successful in implementing their demands?
Well, as you know, the California Nurses Association has fought for many years to get staffing standards in place, and California has led the way. And numerous studies show that as nurses become more and more responsible for more and more patients, that mistakes happen, both medical mistakes and nursing mistakes, and then the whole system begins to break down. Sutter would like to roll that back. Not only would they like to roll that back and make nurses work more, longer, harder hours that they control. Nurses typically have families and are usually unable to do that, but they also want to cut out any areas in their business model that are non-profitable. So we see their psychiatric units closing, we see dialysis units closing.
Aren't they public nonprofit hospitals?
They are not a public. They are owned, they're a private corporation, and they are not for profit, which is different than non-profit. And the fact of the matter is that we really need to look at that, because they are making billions of dollars, and that they don't return some of those profits to their employees at all levels is just unconscionable. I guess America has really got it backwards for this last decade anyway, where we need our businesses to serve their employees, to serve the community, and not serve the bottom line. But now it's come to the point where they only serve the bottom line. And when you get a neocon right-wing organization like Sutter, which it really is run by a board of directors.
Who are these neocons on the Sutter board?
Well, Pat Fry's one of them, their CEO, which is over Sutter right now, who makes about $4 million a year. And
that's pretty good for a nonprofit.
It is pretty good. I wish I don't know if I would even take that amount of money. I wouldn't feel right. But no, those need to go back to the employees, like I say, at all levels. And once we turn around corporations from just serving the bottom line throughout the country, starting maybe here. And
so how can you turn it around as long as these people are in charge?
Well, it's the truth is that without the nurses, the hospital doesn't operate. Without labor, things don't get built. So the bottom line is when the people decide that they've had enough, then they'll act, and they will take back and get what they need, I think.
And you're saying the nurses now have had enough, because you've had a number of one-day strikes and lockouts for going back. How long have you been negotiating?
We've been negotiating over a year, but some of the hospitals have settled now. Slowly but surely the cogs are turning, and we will win the fight. And at some point, it won't be worth it to them. Although they're putting up a mighty show for the rest of the country that we own them, we can pay them whatever the heck we want. But basically, if we lose this fight, what it is a step back towards what I believe a corporation like Sutter wants, which is slave labor. So, I'm not willing to be slave labor, and none of my colleagues are. So we're out here again today, and we will continue to come out until.
Now they've apparently spent a lot of money on replacements, and you have these guards out here. I mean, it seems like they have an unlimited budget to fight you at this point.
It does. Isn't that interesting that they have an unlimited budget to fight us, where they could just give us a fair wage and a fair contract, and we could all go back to work and serve the community? But that's not what they're interested in. I mean, once you understand that they aren't interested in a fair contract, they aren't really interested in money. They're interested in breaking a union and showing the rest of the country that they can break a union, and thus get back to their old bottom line and making more money for them.
Now, aren't they required under California law to contribute a significant portion of their funds to the community, and what is the status of that?
Well, that's true. They're supposed to. They don't. And
is it being enforced? I mean, is the Attorney General?
It actually is not being enforced. And we need to do something about that with the legislature and local governments, and start to look at not-for-profit statuses and what actually a corporation like Sutter in Berkeley at Alta Bates give back to the Berkeley, Albany, Oakland communities. And I suspect what you'll find is not much. I mean, it's the same thing that happened over in San Francisco, where they want to build a brand new CPMC and made deals to keep another hospital open.
St. Luke's?
St. Luke's open, and they found paperwork just before they were going to close the deal saying, under the table, we're going to tell them whatever they want to hear. We're going to do whatever we want, and they were going to close that hospital. And I suspect
do you have support here with other unions?
I think all unions are in support of this action. I mean, these the union movement in America is very weak right now, and we need to step up, and all unions need to step up, and workers need to assert themselves again in order to take back. Sure, I sound very socialist, but a means of production. And
well, we were just on the picket line at the airport. You got the SEIU 1021, where they want to take away, things from them. It seems like there's a union busting kind of concession drive going on against all workers.
Yeah, well, when you have something like Citizens United in place and corporations are given carte blanche to buy our political system, this is the result. And I think people are starting to see that it just doesn't work. I think the last election was a good thing, and it moved us in the right direction, but there's so much more that needs to be done. And people are in pain, and the way we got out of pain last time was through the union movement in America.
You're talking about the 1930s?
I am, and we need to do that again, and we need to have that kind of movement again.
Now, as a result of them bringing in untrained and possibly unlicensed staff, a patient died here previously?
I don't know the story on that, so I'm not going to really comment on it, but clearly I know that the staff that they do have aren't as good as the staff that they've hired that are out here today that should be inside the hospital taking care of patients. And
are they licensed? Are you?
I'm sure that they have license. I don't know what they're doing in there. You can see the guards over here. They won't let us get near the place. I wouldn't want to be a patient in there today. Let's put it that way.
And what can people do who want to support your struggle to get a fair contract and keep your conditions and benefits?
They can support their nurses. They can let us know that they understand our position. They can write letters to the editor saying that they want their local nurses to be working for their families and their loved ones. They can come out here onto the picket line. They can support their own unions that they're in. They can vote, and they can elect representatives that are going to support their point of view that people should receive a fair wage and be treated fairly.
So you're saying the 1%, you got to have 99%, the 1% of the people running Sutter, is that what you're saying?
Well, it's probably 0.01% running Sutter, so 1% is a big, broad category, but when you really look at it, it's a very few people that are running the United States now in terms of cash, and it's a bad situation, and we have to draw the line somewhere.
And there's a recent report that monopolization of the hospital chains has led to higher prices for the public, for users of healthcare?
Well, absolutely. I mean, what would you do if you had the, you were setting prices and there was no competition and all you cared about was money? So, yes. And in Berkeley, Albany, and Oakland were very concerned originally when Sutter started to monopolize the healthcare in the area. And Sutter made a number of commitments to the communities, almost all of which they've broken now. So their word is really bad. And
so you're saying they're lied to the community about what they're going to do?
Well, they are liars. They're big old liars. They continue to lie to the public, and they continue to lie to their own employees, and they continue to lie to themselves. And I guess they're of the opinion that if they lie long enough and hard enough, maybe they'll believe it. So
now the CNA has supported single-payer public health. What plans does the CNA have to have a single payer in California, and to remove the insurance industry and people like Sutter from control of healthcare?
Well, single payer, you said it, is still the mantra, and that we need to move towards that. I think Obamacare is going to put us in the right direction, but Medicare for All, which they talked about for 2 seconds during that fight, was a fabulous idea. No, Republicans were supporting it for like 2 seconds before they realized what they were saying. And hopefully we'll get back to that. And in California, there still is a movement for a single-payer insurance. That we need to get rid of Citizens United, and
do you think you should have private companies in charge of healthcare? Private insurance companies and companies like Sutter?
Personally, no. But this is America, and America is built on business. Dick Gregory said that if you aren't running a business in America, you should move to a different country because that's all they do. All the laws and all the breaks and everything are set up for business, and not really for the people anymore, not for the unions and not for the workers. But that can change. I mean, and it's a constant process, and we all have to be part of that process all the time.
So you're optimistic, despite the difficulties labor's facing, that they can overcome?
I have to be optimistic, and I've seen so much change over the years. My mother was a nurse. She's 82 now, and I walked the picket lines with her in San Francisco before nurses were allowed to unionize.
When was that?
That must have been the early 60s. And the firefighters went on strike and the nurses went on strike. And of course, in San Francisco, this was the birth of CNA. They were all going to be arrested because it was, they were a danger to the public. Although we insisted no danger to the public. And won the right to unionize, essentially, and then right after that we saw firemen and public servants, police, nurses unionize across the United States, and really that's the norm now. So I hate to see it go back to not only healthcare controlled by a private insurance company making billions of dollars, but them controlling the unions and every other facet that we have, and we go back to kind of the government or the corporation town. You can't even buy your
the company town.
Yeah, the company town. Yeah, can't even buy your food or your health care or anything else unless you deal with them. They're making a horrible mistake here. I mean, what they've done just on an individual basis here at Alta Bates and the other Sutter facilities are striking today. The really disrespect and dishonesty that management from top on down to lower management has shown during this process and deceitfulness is not something that even once this is a one battle is going to go away. I mean, you can't give up any kind of credibility you had and then expect just because you come and bargain in good faith, which they haven't, and create a contract that they're going to wipe out everything that they've done.
So you're saying the nurses now are getting pretty angry about what's been going on?
The nurses are angry, and they aren't going to forget. I mean, it's not like Sutter's going to be a different corporation when they settle, and they will. But they didn't serve the community yet again by the disrespect and the lying that they've done to both the nurses and the community within the bargaining and within their outreach and publication to the public about what they're doing. And when you do that kind of thing, you lose credibility as a healthcare institution and as a healthcare provider and as an insurer, and everybody's going to know where they're coming from, and it doesn't matter, Sutter with you for life. I don't know what that really means anymore. It means nothing. So really they've lost more than they know.
A bunch of different things that they thought